Hi, my name is Faye. I'm a clinical facilitator at Treetops Hospice based here in Derbyshire. Today I'm going to show you how to draw up medications for a syringe driver and put them into the pump. Before you start, make sure you wash your hands and you're wearing an apron and clean gloves. Make sure you've prepared all your equipment. We're going to be using the BD Bodyguard T syringe driver. Make sure your equipment has been serviced and calibrated within the last year and it's fit for purpose. You can check this by turning your syringe driver over and looking at the sticker that's on the other side. Check that you've got a written directive that has been prescribed by a healthcare professional. Check that the details are all correct, it is signed, and that your water for injection or your alternative diluent is prescribed. Check that you've got an administration sheet for recording all that medication as well. Then we want to check that we've got all the required consumables. Check that you've got a 20ml BD Plastipack syringe. It needs to be a Luer lock. By Luer lock I mean the screw end. You need a 100cm giving set to administer medications via the syringe driver. A subcutaneous cannula. We are using the Safety Intima cannula with the retractable needle. A film dressing to secure the cannula in place. Small syringes for drawing up small amounts of medication. And blunt filter needles because we're breaking glass ampules. That helps reduce the risk of drawing up any glass shards. And finally, you're going to need to check your compatibility guide, which is available on the Derbyshire Alliance End of Life Care Toolkit. We're going to check our directive. Our resident today is Poppy Smith. She has been prescribed a syringe driver with morphine sulfate 10mg and midazolam 10mg. We've checked all that information is documented correctly, but before we make up that syringe driver, I want to check that those two medications are compatible with one another. For that, I'm going to refer to my compatibility guide. So you're going to find your first medication along the top here. So we're going to go along to the midazolam. You can see midazolam can be made up to a total of 20mg in a syringe driver. Along the side here, we're going to find morphine sulfate. That can be made up to a total of 140mg in a syringe driver. Where those two meet in the middle, you can see a tick. That means that those two medications are compatible with one another in a 20ml syringe. This is the Derbyshire Community Guidance, and that means we make up that syringe to a total volume of 18ml with water for injection. If you came across a tick with 23ml next to it, that means that those two medications are compatible with one another, but you make it up to a total volume of 23ml. You're going to put that in a 30ml syringe. If you get a tick with NaCl 0.9% next to it, that means that those two medications are compatible, but you're going to use sodium chloride for your diluent instead of water for injection. As we've got a tick on our own, we know that we can put those medications in a 20ml syringe and make it up to a total volume of 18ml water for injection. Book your medications out your CD cupboard. Make sure that your water for injection is also prescribed. I have got morphine sulfate, 20mg in 2ml. My resident Poppy Smith, she's prescribed 10mg, so I can see that I need to draw up 1ml of this ampule. I've got midazolam, 10 milligrams in 2 mils. Poppy is prescribed 10 milligrams, so I can see that I need to draw up the whole of this ampule. So our morphine sulfate, Poppy is prescribed 10 milligrams, so I'm going to draw up half of this ampule because it's 20 milligrams in 2 mils. I'm going to use my smaller syringe because I need to draw up a precise amount of medication. I'm going to attach one of my red filter needles. So I've just drawn up 1 ml of medication. So if I've got 20 milligrams in 2 mils, then I've got 10 milligrams in 1 ml. I'm now going to detach the needle and just put that in the sharps box out the way. With my midazolam, I've got 10 milligrams in 2 mils. Because I can draw up the whole of this ampule, I can go ahead and put it straight into my larger syringe. Okay. Hang on to your ampules because you want to go back and double check everything afterwards. I'm just going to remove that needle. My midazolam is now in the 20 ml syringe. I now need to pull the plunger back, make a bit of room to transfer my morphine sulfate to be in the syringe as well. I'm going to attach another needle. And then I can get rid of all of that in my sharps box. My medication is now transferred. I can push that gently to the top of my syringe. Be careful and take your time because you don't want to lose any of medication out the end there. You're then going to attach another filter needle. And we are now going to draw up to a total volume of 18 mils with water for injection. So that includes what we've got in the syringe already. Take your time when you're drawing up your water for injection. I'm just using 2 ampules of water for injection. Take your time stop as many times as you need to, pull the plunger back, remove any air bubbles, push it back up to the top again. We want to get as close to 18 mils as we can. The reason I keep stopping and pulling it back and pushing it up again is to remove any air bubbles. It needs to be as close to 18 mils as possible. If you go over by too much, unfortunately it won't fit in your syringe driver and you'll have to start again from the beginning. So you need to take your time and be as precise as possible. Once you're happy that you're at 18 mils, that's it. That is our syringe prepared. Now we just want to remove our needle and just go back and double check that everything is correct. So I'm looking again at my prescription sheet. I've got morphine sulfate, 10 milligrams. Got morphine sulfate, 20 milligrams in 2 mils. I've drawn up a half of that ampule. Poppy's prescribed midazolam, 10 milligrams. I've got 10 milligrams in 2 mils. I've drawn up the whole of that ampule. Record all that information down on your administration sheet. So you'd have one of these for each medication. So you'd have one for your morphine sulfate and one for your midazolam. You're recording the date, the time, what you've given, what you've wasted, the batch number and the expiry date of the medication, and then you're counting the stock level down and your signature to say that you've given it. Record all your information on your syringe driver label. On your syringe driver label, it needs to say your resident's name, their NHS number, date of birth, what you've put in that syringe. So it should say morphine sulfate 10 milligrams, midazolam 10 milligrams. What your diluent is, so it's water for injection up to 18 mils. Your signature to say that you've prepared it, and the date and time that you've prepared that syringe as well. Once you've recorded all that information on your label, you can pop it onto your syringe. Just avoid covering up these numbers because you still want to be able to see those. And that is our syringe prepared. So I'm now going to get rid of the ampules because I've recorded all the information that I need. Now my syringe is prepared, I'm going to go ahead and prime my line. I'm going to take my administration set. This should be a 100 centimetre line with no ports. I'm going to attach this to my syringe and then just gently push the medication through until it gets to the end. Okay. So you can see that there's a little bit of medication at the end. We are now ready to load our syringe into our pump. I've got a BD Bodyguard T syringe driver. Just make sure that you have got a Duracell Plus battery. These are the batteries that are recommended for use with these pumps. We're going to turn our pump on by pressing and holding the on-off button. allow the syringe driver to do its preload. Once it's ready, it will ask you to load the syringe. Pop it on a flat surface, pull the arm up and twist it around, let the arm go right down. I'm now going to place my syringe in the syringe driver. First of all, I'm going to line it up. You can see that it doesn't quite fit. So now I need to use these forward and backward arrows to move that sensor collar slightly. Pop your syringe in and then pull the arm up and around to secure that syringe and hold it firmly in place. Hopefully that will recognise the syringe, which it has done. It's recognised it as a 20ml BD Plastipack. If it doesn't, if it comes up with a different name of a syringe, use these up and down arrows to scroll and select the correct syringe. If you put your syringe into the pump and you were scrolling up and down and there was no option there for a 20ml BD Plastipack, it's possible that you've not quite put it in correctly. So what you would do is you'd take it out and start from the beginning again. It's very important that we select the correct syringe, otherwise it won't calculate the total volume correctly for you. So we're happy that it's a 20ml BD Plastipack, so we're going to now press the green button. It's worked out the volume for you. Don't be alarmed that it's not 18 mils, that's because we have primed our line, so we've lost some of that medication into our line. It's going to go over a duration of 24 hours. It's worked out the rate for you. We're going to continue by pressing our green button. Now it's asking you to start the infusion. This is where we take the syringe driver to our resident. I'm now ready to connect my line to my cannula, which is already in place. Just going to unscrew the end on the cannula and attach the line. I'm going to press the green button to start the infusion. It will tell you on the bottom of the screen that the pump is delivering and the green light will flash. I now need to press and hold the information button to lock the keypad. We now need to record all the relevant information down on our infusion sheet, which looks like this. You can print these off the Derbyshire Alliance End of Life Care Toolkit. Press the information button once. It says VTBI, that's your volume to be infused. If it goes off the screen, just press it again. You can see here it says VI, that's your volume infused. At the moment that's 0. It now asks you for the rate of infusion, which you find on the front of the screen here. It will also ask you for the battery percentage. If you press your information button twice, it will tell you your battery percentage. When you set up your syringe driver, you record all that information down. Then you're going to go back within the first hour, check it all again, check that it's running to time. After you've done your first check, it's 4 hourly checks that you need to do. The syringe driver has got an alarm. If you hear that noise, you will see that the red light is flashing. That's telling me that that medication is not being delivered. It will tell you on the front of the screen what the problem is. So here it says syringe displaced. It could be that the pump has been dropped on the floor and it's not quite in properly. So you rectify whatever the issue is and then you press the green button to continue. Your pump might also alarm if there's an occlusion, in which case you will be checking the line, checking it's not kinked or wrapped round anywhere. If you've checked your line and your line's fine, but the pump is still bleeping, it might be possible that your cannula is blocked. So you're going to need to change your cannula. The pump will alarm if it's been paused too long or if the battery is low or ended. You will also hear an alarm 15 minutes before the infusion is due to complete. The green light will be flashing, the medication will still be delivering. That's just prompting you to go and prepare that next syringe. Now that we've carried out all our checks that we need, we can put our syringe driver into our lockable case. Take the key out. Now it's secure and that syringe cannot be removed by the resident. If you are doing your checks and you notice that your battery is low and you need to change your battery, what you need to do is press and hold the information button to unlock your keypad. Stop the pump. Turn the pump off. Take your battery out, pop your new one in, then you will have to turn the pump back on again. It's going to run through those exact same checks with you. So 20ml BD plastic pack, we're happy with that, so we're going to press the green button. Now it says press the triangle to resume or square for a new syringe. Remember, it's the same syringe, all we've done is change the battery, so we want to resume. So we're going to press this green button. It tells you the volume remaining, the duration remaining. You're checking that that rate has stayed the same, and then you're going to press the green button to continue. Restart your infusion. Press and hold the information button to relock your keypad. Some important things to remember. Please only draw up syringes when they are due. Do not prepare them in advance, only prepare them as and when you need them. If a syringe driver is set up late one day, it might be that you're waiting for the GP to do the prescription or anticipatory medication to arrive. That's absolutely fine, but bring it forward the following day to a time that's within the hours of 9 and 5, where you've got access to all the services to support if necessary. Review the contents of the syringe daily. If additional doses of anticipatory medication are required, inform the GP. It might be that the dose needs to be increased in line with what they've had. And always refer to the symptom management guidance, which is available on the End of Life Care Toolkit. Check that the contents of the syringe always appear clear, and keep the contents of the syringe out of direct sunlight. You can do that by popping it in a syringe driver case, or if your resident is nursed in bed, you can pop it in a pillowcase or under the pillow out the way. If you need to give anticipatory medication, additionally to what's going in your syringe driver, always pop in a separate cannula. So you've got one cannula for your syringe driver and one cannula for your anticipatory medication. So that's best practice, and that's your Derbyshire community guidance.